Can you guys see my screen okay?
Yes, it's not in presentation mode, but we can see it.
Yeah, that's okay. Well, good morning. Thanks for having me here today. I appreciate everyone's time and attention. As I mentioned earlier, my name is Dan Schwarzlander. I'm the co-founder and COO at CIQ Health. Today, we're going to talk about something that fundamentally changed healthcare starting in 2021, but really most people don't fully grasp the implications. We're talking about the federal transparency laws that forced 300 terabytes of pricing data into the public sphere every month, and how that data is reshaping the entire landscape of provider reimbursement. I'm looking forward today to sharing what I've learned building infrastructure in this space over the past 3, 4 years, show you some real outcomes from providers who are using this data strategically, and just spark some interesting conversations on maybe where this is kind of all headed. So let's just kind of get into it here. So here's a big idea. There's about 300 terabytes of healthcare pricing data, data that was hidden for decades. It is now being published every single month as part of the No Surprises Act passed in 2020. This is data about what payers actually pay providers for every service, every procedure, every contract, every billing code, at the place of service, modifier, kind of the nth degree of detail. And this transparency information is fundamentally reshaping how providers negotiate, how they get paid, and how they understand their position in the market today. So let me take you back kind of where this all started back in 2021. I never take for granted kind of everybody's kind of frame of reference on this. So in January 2021, the federal government enacted something called the Transparency and Coverage Final Rules. I know it sounds like a kind of jargony, but trust me, it was a seismic or just a crazy shift in healthcare economics and information. Here's what that law mandated. Essentially, every single commercial payer must publish every single one of their contracted rates, in-network contracted rates, every provider, every service, every billing code, every contract, every line of business commercially, every network in a machine readable format. And they have to update it monthly. So this data is constantly changing every month. So think about what that means. For decades, literally decades, payers had complete market intelligence. But they knew what they were paying every provider in every market. They could see who was expensive, who was cheap, who had leverage, who didn't. Providers, well, they knew their own rates, but that was about it. Most providers we talked to, or many providers we talked to, can't even find their contracts, or just don't even have that type of detailed information just about their own practice. So this is just basically a textbook definition of information asymmetry, and it kept provider rates artificially low because the no one had the data and to understand what they were being paid, and this just led to providers being not paid competitively. So what happened when this law went into effect in July 2022, we started seeing this 300 plus terabytes of data being released every single month. To give you some perspective, that's more data than the entire Library of Congress, and it's coming in over a thousand different file formats, mostly JSON, but some CSV and some other ones. Basically deeply nested um, structures here that could make kind of any person trying to wade through the data kind of just really sweat and kind of get frustrated. But we're talking about billions of the individual price data points on providers every single month. Updated, changed, format's changing. Format's going to change again next year in February. But that was a great start, right? This data that was basically hidden for decades, suddenly public. It's always liking it to go into the grocery store and you walk into the bread aisle and there's just basically a bunch of like either kind of really complex kind of price tags on it or some question marks. You're just trying to buy something and you just don't know how much anything costs, right? Or you had to go to some other catalog somewhere else to figure it out, right? That's kind of how crazy it was. So what does this data reveal? Um, there's about a 350% variance in reimbursement rates for things like identical services in the market. So let me make this concrete. Imagine four different providers in the same city, within, let's say, throw a rock at each other. They're all family medicine practices. They're all performing very nearly or very close to the exact same services, billing codes, same setting. Standard office visit, same complexity level, all that kind of stuff. Pretty pretty similar. But you just have this crazy variance. One provider's getting $75, another's getting 180, another's getting even more than that. This is the same code, the same work, almost literally the same location, same types of patients. So this is just it's just crazy, right? Now here you have provider A is probably losing money on seeing every patient with this particular, this billing code here, right? They may not even know it. And we talk to providers and they just will hear from their peers, hey, I'm getting paid this, and it's just they just kind of have that can't even be true, right? But these providers, especially one, they just know their margins are extremely tight, and they just seem to be working harder and harder every year. The Medicare rates maybe aren't increasing in the way that they might expect them to. But then on the other end of the spectrum, you got provider D, literally doing very similar things. They have very healthy margins. They have this type of activity is generating resources that they can reinvest into their business. Maintain independence, right? Maybe provider A is kind of, hey, I got to really go look at kind of maybe joining a system, selling my practice, or just being an employed provider. But before transparency, no one here on the spectrum knew where they stood. Everybody kind of thought they were doing fine. Provider A, hey, maybe times are tough, but things will get better. And then provider, D on the other spectrum here, right? They don't even understand that they're in the top tier of things. They just thought they were kind of running a solid business. So this matters because healthcare is already operating at razor thin margins, as we all know. Independent practices are closing at alarming rates. Somewhere around 30% are at risk of closure or forced acquisition by a health system. And a big part of this is just systemic uncompetitive that they didn't even know was happening. So that's kind of some of the setting here. So the problem here, this data, right? Great data, but it's just raw data, right? It doesn't immediately equal usable intelligence. So the data is public, it's comprehensive, but it's absolutely not instant usable intelligence, which is really, and this will make sense as I talk, why this data is just not sitting on every street corner. So let me paint the picture. How the insurance companies choose to comply with these regulations allow for plenty of wiggle room. So you've always got to stay on your toes. For example, some payers split their data across hundreds of individual files, right? So instead of saying, hey, one payer, one network, you have one payer, one network, and hundreds of thousands of individual files. It's kind of like a Humpty Dumpty in 1,000 pieces, or a jigsaw puzzle in 1,000 pieces there, right? So this makes for a cumbersome process to create a unified data set. Then you've got the data quality challenges, missing fields, inconsistent schemas, errors that don't make any sense. Different ways to label identifiers for providers. Craziness around tax IDs, MPIs. There's just a whole lot of different formats and standards, and just makes it really, really difficult, cumbersome. And remember, this data updates every month, right? So even if you figure out how to publish one payer's files one month, the next month the format might change, they might fall off, issues on, let's say, just the payers that just naturally, right? Not in a nefarious way, but just naturally they have their own technical challenges, being able to publish the data on time or consistently, just like when you're doing any sort of technical task, there's just no consistency. So the result, most providers, even large health systems with dedicated IT departments, can actually use the data kind of in its public form. Again, it's technically public, but it's not practical to manage this this process, to manage this process in any kind of way for a provider that kind of fits in their business in terms of things that they do all the time, and the complexity is just a barrier. So we built RealRate. Our mission here at CAQ is pretty transparent, no pun intended. Transform these 300 terabytes of monthly transparency data into an instant actionable intelligence that providers can actually use. And we build a proprietary methodology really early on to effectively interpret this data. We call this algorithm, this process, RealRate. And we like to think of it as like a Zillow's estimate, I should say, for healthcare contracts. You know how Zillow can tell you the exact worth of your house based on comparable sales in your neighborhood. We can do the same exact thing with healthcare reimbursement rates. Right now, our approach covers over 200 payers. This is over 500 commercial networks nationwide. All the national payers like Blue Cross plans, Aetna, United, but also regional payers. And again, it covers any commercial plan. So large group, small group, individual, and any commercial plan. I'll say the only gap is there's just no Medicare Advantage or Medicaid data there. So just know that'll be something that's not included. I think that might change, but we'll see. And I'll also add there's dental reimbursement data. So one of the stipulations was, as part of that, any health plan that has an integrated dental benefit has to publish their in-network dental rates. So we also are working in the dental space, Blue Cross Dental, GEHA, Cigna, United. Anyone has a kind of a dental plan that has an integrated medical benefit is also publishing that. But the value proposition here is really simple. Know what you should be getting paid before you walk into, from a provider perspective, right? Know what you should get paid before you walk into a negotiation with the payer. That's it. You just got to know it, right? There's just no reason not to know. It's really important to be able to stratify, your business, what you're getting paid. Is it competitive or not? So kind of no more, when you talk to these payers, no more guessing, no more saying, hey, we need to get a fair increase, right? A provider walks into a payer discussion and they know exactly where they stand with our process here in their market amongst their peers. So how providers use the data. Here's kind of a typical workflow that providers go through when they start leveraging transparency data strategically. The first step here, discovery. This is where we run what we call it the impact analysis. It's a free or complimentary benchmark scan where we pro bono look at their contracted rates and their top CPT codes and compare them to their peers, market averages, et cetera. We identify specific gaps. You're getting paid, let's say, $120 for this code, but the average is 165. Your peer is more than that. That's a significant gap. You're billing this code, let's say, 800 times a year. That's tens of thousands of lost revenue on this one code. Second step, contract visibility. Most practices have their contracts scattered everywhere. Don't even have them. Filing cabinets, email inboxes, shared drives, people that weren't former employees, just all over the place. We want to help kind of gather those contracts, organize them, digitize them, and then kind of create kind of a renewal and revenue engine around that particular contract. So renewal alerts, making sure that you're getting paid what you should be getting paid based on your claims, building kind of a calendar of your business around those kinds of activities. This kind of active or proactive payer management, payer relationship management, just saves the practice dozens of hours of administrative time. As we all know that this administrative pain with payers can be significant. And third step here, the benchmark analysis itself. This is where our RealRate process really shines. We show them exactly how their rates compare to the market. Not just averages, but just actually ranking the practice. So, for example, you're ranked 5th as a practice amongst your peers for this payer code place of service combination. right? And that means you're not getting paid competitively for the same work as your peers. And these people are peers, are similar sized practices, except the same payer. Um, uh, just appear in that way. So the fourth step here, the actual negotiation preparation or negotiation prep. So we build data back, data driven negotiation cases with side by side comparisons. So here's where you're getting paid. Here's what the market bears. Here's what this specific payer is paying other providers just like you. Um, so just really providing the right level of detail there. Again, going into the negotiation itself. And then step 5 here, execution. So the provider, in a collaborative way, right, presents this information to the payer. And we've just seen this conversation change completely. It's no longer kind of the can you please give us a raise kind of question. It becomes more around, hey, here's the market information, the market data. Here's where we should be. Let's discuss together, right, how we can get there. So it's really a business discussion between equals that's driven by the data that these payers they're publishing themselves, right? So it's their own information. And then the last step here, which is just ongoing monitoring, right? So once you're kind of using our platform, our real rate process, this data process, you need to continuously track performance, monitor what's going on, changes in your market, because people are not just you are negotiating contracts. Everybody's negotiating contracts all the time, so the market's just constantly changing. So keep monitoring what's going on in your market. Get alerts around upcoming renewals, changes in your market. Maybe peers that have a different rate, different kind of shifts in your market. And again, we just found that the shift in terms of thinking, in terms of approaching payers, goes from kind of, let's say, even a timid, asking for a favor type of approach to just saying, hey, we want, what market parity, or we want market competitiveness, right? And this allows the providers really to feel empowered in a good way. So couple case studies, couple examples here. In the next couple slides, we'll kind of step through. First, let me tell you about a four-provider hospice practice in California. They provide end-of-life care, very essential, compassionate work. Two physicians, two nurse practitioners. They've been kind of a business for over 15 years and just have a very strong community relationship and reputation. But just financially, though, they were really struggling. The rates hadn't changed in more than 3 years. Meanwhile, the costs were just going up every year. Salaries, medical supplies, rent, insurance, compliance. They just were getting squeezed. Then their third largest payer, representing about 30% of their total revenue, sent them a contract renewal notice. The terms are basically continuing the current rates for another 3 years, no increase, no cost of living adjustment, and they had 60 days to kind of accept that or walk away from 30% of their patient volume. And that's when they reached out to us. Again, we ran this comprehensive impact analysis on their top 15 codes just to really confirm ROI before any sort of engagement type of discussion. And we did this for these 15 codes across their 7 top payers. And here's what we found. For hospice continuous care, the 24-hour care for patients in crisis, they're getting paid about $800 a day. The market average was about $1,100. So that's a 30-40% gap. And they were providing about 100 days of this continuous care per year, which meant they were leaving $30,000 or so just on the table annually there. So when we looked at all these 15 codes, the total opportunity was in the $150,000 $200,000 range. They were just being systemically not paying competitively, and it had been going on for years, and they just had no way to know about it. And the practice owner kind of said, and in their own way, right? Hey, it was kind of a feeling of kind of relief, but also frustration or even anger, right? We didn't know we were competitive, and we've been paid uncompetitively for a long time, but now they at least knew, right? And they can do something about it, or they can begin to use information to approach a payer collaboratively. So what happened? They went back to their largest payer and said, we just can't accept this renewal at these existing rates. And they said, here's the market information showing that we're 30 to 40% below market on multiple billing codes. Here's what we think competitive reimbursement looks like. Let's have a discussion here. Not a tense negotiation, but let's have a collaborative discussion negotiation here about kind of a reimbursement. And the result of this was five of their seven payers agreed to increases. This an average improvement of about 10% reimbursement overall. Hundreds of thousands in revenue impact to their business. It didn't all happen at once, right? It happened over 3, 6, 9, 12 months. But this because this negotiation came, but it's really a significant um, impact on their business. So let me show you another example. This time kind of more the strategic intelligence kind of approach here. So this case study is around a multi-location vein treatment provider. And they're a larger group, multiple locations. They weren't in immediate financial crisis, but they needed more strategic direction. They were asking, hey, which of our payer relationships are kind of competitive or healthy? Where should we be thinking about renegotiation focus efforts, brain power there, and where might we be leaving money on the table? So we ran a comprehensive real rate analysis across 5 major payers, 7 networks, 29 different billing codes that were core to their operations. We benchmarked them against 6 peer organizations, similar size practice, multi-state entities, and local health systems. And the first step, and this is part of anything that we do, is validating the data accuracy. That it's just really important to get the data right in healthcare. If you don't have the data right, it's a problem. Dick's on my call, so I always like to give him credit for this. Healthcare moves at the speed of trust, and if telling the data story correctly and validating it is building trust in the data so that it can be used. So we had a 99.2% match rate, which gave them a good, strong confidence that we were showing was real, tangible. Then we mapped out where they were competitive and where they weren't. The results are pretty striking. With Payer Z, they were competitive or above market on 18 of their 18 codes we looked at. Great relationship, great rates. Just feel good there, right? No need to kind of go rattle that cage. But Payers X and Payers Y, they were not competitive for 10 to 12 of those codes. And they were in the bottom quartile for key procedures like vein ablation and sclerotherapy. Codes they just bill hundreds of times a year. The strategic decision became pretty clear. Prioritize negotiations with payer X and Y. And here's the smart part, right? They use Payer Z's rates as the benchmark in those negotiations, right? So you're paying us significantly less than one of your peers payer for the same work. Can you help us understand what's going on? Let's bring your rates into kind of market alignment competitively, right? And I'll say like payers do some of the frontline people at these payers, they don't have access to this information either. So we found again, if you're just very constructive, collaborative about kind of sharing this, they do learn and they want to be competitive in their market too. So I think that's a good thing. But this is what a data-driven strategy kind of looks like. Kind of usually it was kind of guesswork, kind of trying to read between lines versus just kind of data-driven information. Changing your like, hey, we're probably underpaid somewhere. to like, okay, which payer specifically do we have a problem? What are the codes? And what is the delta there? So these weren't isolated cases. We see patterns like this just over and over again all across the country, different specialties, different markets, provider types, all sorts of things. So the pattern we see here across our clients, and so let me step back and show you the patterns we see across these different providers, specialty markets. On the finding side, we typically see somewhere between 15 to 40% rate gaps on specific payer code combinations. We find providers who are in the bottom 25%, meaning 75% of their peers are getting paid more than they are, and they just have no clue. We just talk to providers all the time, even though this data's been out there, and that have just never heard of the transparency information. So we're still in kind of an education phase for some providers. But even some of these high performing providers in that upper 75% have weak spots in certain areas. Maybe they negotiated really well with one payer many years ago, but another payer has kind of been underpaying them ever since. And and let's say their patient mix from these payers have changed over time, impacting kind of what was maybe a less of a weak spot has changed to more pronounced. But here's the thing: about 70% of independent practices today are getting not paid competitively on at least some payer code combination. It's not that they're bad negotiations or not good at business. It's just that they just not had the information, the data to just understand. They just literally did not know where they stood. On the outcome side, we generally see a 12 to 18% average rate improvement after providers renegotiate with data. That translates to about 5 to 15% overall revenue growth, which is huge with an industry that has somewhere between 2 and 5% margins in a lot of cases. And we also see about a 70% reduction in contract administration time, right? Just the hassle of this, because CIQ, we're automating so much of this manual work, the tracking, the benchmarking, that sort of thing that kind of go along with the negotiation or the client's negotiation consultant or themselves. And the ROI is crazy, right? It can be hundreds of percentage points for these providers. You just mean that every time a dollar gets invested in kind of this activity, and again, we don't with that impact analysis, nothing gets invested until we show there's an ROI. But every dollar that gets invested, there's a meaningful amount of money that kind of comes back and kind of, result. So the key insight for decades, payers just had all the market intelligence, all the resources, even some of the very large providers, right, could buy very large claims data sets. Just, they could afford to. And, the small, mid-sized providers and even some other ones too, just didn't have anything. And this is asymmetry, we thought kept reimbursement kind of uncompetitive in many ways. It just gave the leverage to people that had the information. What we're seeing now is that transparency has broken that data asymmetry. Providers now finally have access to the same intelligence payers have always had. And then when providers negotiate with this data, right, they can approach the payer, let the data speak for themselves, and just kind of have a more collaborative discussion. Help me understand, payer. Here's what I'm seeing in the market. Here's your data. Tell me understand what I'm seeing here, right? We find so many instances where that just in a very collaborative, constructive way, right, allows the unlock for a positive discussion about getting paid competitively. So let me zoom out here and talk about what transparency data enables beyond just provider reimbursement.
Yeah, Dan, I just wanted to be respectful of your need for a hard stop. And so you want to judge accordingly. We do have a few questions.
I'll try and wrap this up up really fast here, but I just want to point out, like, hey, you have a whole host of people that can benefit from this transparency data, right? Employers that are selecting different networks. What can data tell them about which network is the most cost effective? Obviously, any patient wants to know this. Anyone doing health research, policy making, this is just kind of just the start of all this. So I'll wrap here, which is just um, bring this home to Casey in a way. So we just been, I'm ex Cerner. My co-founder Aaron Shoemate, he helped found a company in Kansas City as well around healthcare data that went to private equity. So we just want to give back, right? We're local healthcare tech folks. We just appreciate Kansas City. We wouldn't kind of build our company where else, and we think there's real potential. As many folks in the call, I believe Kansas City become just a real Midwest hub for tech innovation. And I'll just say, like, we often get say, hey, like, how can I help, right? Or how can you help? Just connections for us, right? We're at 40, 50 clients now. So always take any sort of independent practice introduction. We can do that free scan for anyone. But insights, right? What can we share about the data in our markets or different markets? A collaboration. But then I'd say, like, what can we do for you? I'll end with this, right? Just, these free impact scans, we're building a data technology company in the AI age, right? We found really ways to kind of unlock our process there in a good way. And then we have a deep healthcare infrastructure expertise, and we're happy to discuss any sort of partnership stuff as well. So with that, I'm gonna open it up for any discussion or questions.
Yeah, this is Doug O'Hulan. One question I have is for patients, is there an option to have patients kind of figure out where they can, like for blood tests or other medical tests, find their lowest cost solution?
Yeah. So that's trying to be solved in a couple ways. One is another piece of the transparency regulations was that hospitals had to publish what's called shoppable services. So it's about 100 common services, and sometimes like that type of test is included in that, and that's published on the hospital website. And I think there's a lot of companies out there that are actively using that to approach consumers. I think what I found just in my experiencing before this is just that you have to, it's very you have to know in advance kind of as a consumer what you're looking for, what you're going to be treated for, and then you got to go find it, right? So it can be kind of hard in that way. I haven't seen a really great way to solve. I could see in a good way, right, over time, this is integrated into, let's say, the office visit of a clinician, where they're going to, let's say, refer you to a specialist. And at that time, you're starting to understand, okay, before that doctor makes, let's say, an appointment or referral for you, you get a really clean picture from the provider, maybe at the same time, just hey, here's other providers in the market, right, reimbursement wise. I don't know exactly how that will work, but I feel like the experience for, let's say, getting that care could, in terms of integrating with data, could be better. So.
Right. Yeah. I mean, example is I had a blood test for my family doctor and then my specialist, and my cost of out of pocket was twice as expensive.
Yeah.
Now the other thing is when I was looking at an MRI, I got the billing codes and everything. They could tell me, what is the, what they're going to charge the insurance. But I said, well, what's the negotiated rate? And they said, well, we can't tell you that until after we bill it. And
Yeah.
because I have a very high deductible, it's kind of like, well, is it better to pay out of pocket and get a 30% discount versus go through the insurance? And unfortunately, I didn't have, it's not an urgent issue. So, but, it's a couple $1,000 and it's like, okay, how do I make this decision? And they couldn't help at all. So from
Yeah.
a patient perspective, does your solution help with that?
No, right now, I mean, I think eventually, right? But right now we're just focused on, like, the frontline business of, like, hey, because, like, to your point, right? Some providers don't even understand what a going rate is in the market, right? So I think
Eh,
eventually, like, we could get there. We're starting here at first, and but we are, I think probably the way that we'll get there is probably through a partnership or another company that's kind of really member facing, more patient facing more than we are today. But I'll say I think the fundamental challenge with anybody doing this is just the workflow with how care happens between the patient, the doctor, and these different kinds of things, right? Just how do you, in a good way, introduce the cost component so that people can feel like it makes sense to see that information rather than like oh, hey, I'm going to go see this particular provider and get this particular service, right? What might they do? You have to know your own billing code. It's going to be really hard for a patient to know what that is. So
Yeah, so for the record, with AI, like I'm getting one test, I said, okay, what's the
yeah,
procedure to find out everything on this code and how to get the lowest cost possible? And it gives a nice workflow on how to do that. So, I think the patient's
AI for
going to
the
be
win, right?
exactly. So I think more and more patients are going to take more charge of this, especially when they have very high deductibles.
Yep. Yep. Absolutely.
I think we also had a question from Joe Bush. Joe?
Hey, thanks, John. Yeah, Dan, good stuff here. I did drop this in the chat, but with the CIQ solution, are you primarily focusing on the provider side of the house?
I'd say like right now, yeah, you
Okay.
know, well, and I'll say like we also have the other data assets outside of a transparency that like it could help other
Yeah.
stakeholders in the community, payers, things like that, like in network information.
Okay.
So
And I think so. I'll just add a comment, and I'd love to connect with you at some point in time. This builds on Doug's use case. Everything you just shared there is, I think it's music to ears for the providers because it grows the revenue, but it also, who's paying for that is on the employer side. So there's a monster market for you on reducing cost of care, not increasing the cost of care. And
yeah,
but yeah, I mean, I think there's multiple markets you can serve here if it's packaged correctly, but I'd love to connect with you at some point.
yeah, let's absolutely connect. And I'll just say like our approach, is not like a win-lose scenario, right? With the payers and the providers and all the people involved. Our approach is like, hey, let's get paid competitively, right? So if there is scenarios where, we saw that one provider that's doing crazily well, right? That person, maybe doesn't make sense for them to say, hey, I need an increase, right? But can we help the other? So it's just kind of like it's a balancing act in a good way, right? And we're hoping to introduce some sort of real market approach to this, right? Because that's the most efficient way to handle these kinds of problems. And not that this is the perfect and efficient market right away, but this information provides more of a market than there was before. So we think that like that approach, again, in a collaborative improvement approach can help. Another thing I would add too is the administrative costs placed on providers as part of this relationship with payers, right, is going to help lower costs too, right? So as this relationship gets healthier over time, we want to see like one way we could go is just would be the place for payers, providers to have healthy relationships, financially and otherwise. But lowering the administrative burden of that kind of activity places, prior authorizations, underpayments, mispayments. If we can help resolve those kinds of things in a good way, payer wants those resolved too, then that creates a more profitable environment at the existing reimbursement rates that the providers have. So there's a lot of costs associated with just getting paid from a provider that's not even the actual payment. So
Good stuff. I especially appreciate, Dan, the connectivity that you express for the KC community, both in terms of what you offer as well as what you could use. That's a really nice expression for us to hear in this kind of venue. So thank you very much for contributing that. Do we have any other questions amongst the group? Dan, if you have a second, I would invite um, those who joined us since we started to quickly introduce themselves so you get a better picture of kind of who was around the table with you today. Is that okay?
Sure.
Great. Let's start with Catherine, please.
Yeah, my name is Catherine Burt. I'm a product manager for Alamu Informatics.
A great Kiswahili word, which I appreciate. Dennis.
Thanks, John. Hey, Dennis Radnauer, CEO of BioNexus KC.
All right. We have here. Who is listed as Saidi or Saidal? Maybe we won't know. Shannon.
Hi, thanks, John. I'm Shannon DiMaggio with IC Stars Kansas City.
Great. Anybody that I have missed? We welcome you to say hello. Okay, Dan, we can let you go to your commitment. And again, thank you very much. This is, to me, a real advancement in this space. And it's great to see it happening in Kansas City and with fellow Cerner alums.
Thanks, everyone.
Take care now. For the rest of our gang, I just wanted to alert you that we'll be sending out a mailing here in the next week or so that is really the appointments through our monthly cadence, so January through October. And for those of you who have an email or a calendaring system that those things just stay there, you don't have to respond at all, but it will allow you to have visibility of that coming up each month. And then in turn, on an individual monthly basis, we'll update the appointment for that month with the appropriate agenda. So you'll get those updates as well to those appointments, but you'll be able to see them. They will have visibility for you over time. And of course, if there are those who really just kind of want to drop out, simply responding with a decline will be enough for us to be able to take you off the list and not bother you further if that's your choice. But we're really looking to have some more folks join with us, people who may have dropped off before, who may still be interested, and make this the forum that we want it to be. So I actually invite you to look at that and consider it accordingly. Some of you may need to respond to it as maybe or tentative or whatever in order to keep it on your calendar, and that would be a good thing too. Now I'd like to, just before we close, is there anybody in the group who has a sort of community announcement that they'd like to make? Jessica, why don't you say a little bit more about your investors group? Jessica, still with us? Okay, we'll turn it over to Shannon.
Thanks, John. And I apologize, I'm not on camera. I have a snow cap on right now. I'm a little windblown. So I'm trying to preserve all of you from having to witness that. Thank you for the few minutes to present. IC Stars Kansas City is on the heels of presenting their third annual Hack the Dream Social Impact Hackathon. That will happen in February of 2026, so February 26th, that last Thursday during Black History Month. This year's theme is centric to AI equity, something that I think most of your participants and attendees and listeners know very much about, probably much more than I do. So we would love to extend the invitation, and I will be sure to support this announcement with a link for more information to the event itself. But it really is probably one of the coolest events that IC Stars does throughout the course of the year, because the engagement affords an opportunity for industry leaders like yourselves, students from the KCPS district, and others our interns, our community partners, everyone really across the spectrum to engage and collaborate and ideate in conversation and solution about things that are vitally important in the tech space, AI equity being one. So thank you, John.
Sure, Shannon. Glad to hear about it. Thank you. Any others that might have a community announcement? Okay, well, we'll leave it at that for this month. Sorry that it was a little bit shorter than usual, but we certainly appreciate everybody showing up, contributing. We really value your input in how things get shaped here in Kansas City. So we will continue as we move forward into the new year and look forward to connecting with you all. And happy holidays to everyone. Thank you.
Thanks. Happy holidays.
Bye, all. Thank you.
Thanks, John.
Thank you.